COVID-19 update and discussion of possible removal of weekly reporting.
And mask advisory, that was in place.
And mask
it.
advisory, yeah. So why don't you, Jen, just kind of sum up kind of cases and things like that, if you can?
So 2 weeks ago, the schools were at 38 for the total in the amount of in the schools. Last week was 37. Thanks. Last week was 37. Currently this week there's 15, and townwide this week there's only 6 cases. So we're trending 6. Okay. So we're trending definitely in the right direction for a couple weeks now. Beginning July 1st, the Mass Department of Public Health advises that masks indoors are optional for most individuals. Masks are still recommended for those at risk for severe disease and require in certain settings such as healthcare facilities. Another note, the FDA is scheduled to meet this week to discuss the Moderna and Pfizer vaccine for children under 5. As FDA and CDC conduct their independent review process, the Biden administration is planning a vaccine rollout for this age group. First, vaccination for this age group may start as early as the week of the 20th. So we got some definitely moving in that direction.
Yeah, so I think that with us being down to 6 cases in town, although I guess if we still have 37 in the schools, I'm probably right around that point where we don't need the weekly reports.
Yeah, I mean, I think when we restart the weekly reports, here's Melissa, and I'll wait for her.
Okay.
Get the microphone. You need a microphone. The acoustics in here is terrible. Sorry.
Sorry, we just started. We are being recorded, so as soon as you get settled, we'll pick up where we were. So Jenna just said that the schools have gone from 38 cases to 37 cases, and in-town cases are now down to 6. Yep. Is that right? And so we're talking about the COVID-19 numbers.
Yep.
So what I was going to say was that when we restarted the weekly reports, at that time there was a significant uptick in cases on a relative basis. It was still low compared to what we had experienced in January through February, but we didn't know which way it was going to go. And it seems pretty obvious that those cases now have sort of peaked at a low level and are heading back down. So I think I think at least for the time being, I feel confident we're not in the midst of a major resurgence. Do I expect that we'll have further upticks in COVID cases in the future? I think that's probable, but at least for right now, I'm not sure that the weekly reports are serving a useful function.
So I'm sorry, that was the school report or the town report?
I'm talking about the...
No, I'm just looking up through, but we don't have the reports, right?
No,
the most
not
recent
yet.
report?
Okay. The weekly report that we put on the Board of Health website.
No, I haven't seen the most recent numbers.
38 last week, and 37 this week. No, sorry, 37 last week, 15 so far this week, and 6 for the town so far this week. And I believe 28 for the town last week.
Yeah.
Thanks.
Yeah, so I think that in terms of the weekly report, I'm fine just kind of having that go back to the monthly, just because it saves on staff resources and timing. I don't know, Melissa, you get to weigh in too, but trying to figure out what's best for our staff resources in terms of balancing what they're doing with, just trying to keep the public informed. I mean, I think that it's pretty obvious that we've had COVID around Westborough. We're going to have COVID around Westborough for a while. I don't see this going away. I don't see it like spiking right away. So I think that if something starts to change one way or the other, we can, certainly be flexible about, going back to the once weekly. But right now, it seems like it's not really letting the public know too much more.
I mean, the problem with monthly is with, summer and families, looking ahead toward the beginning of the school year. I think it would be nice. I don't know if we need to do weekly. I don't know if we would consider bi-weekly instead. just so people can have a clue without waiting until, the very end of, let's say, August to have an idea of, where the numbers are before their kids go back to school. I don't know.
We may want, like, in August to
I mean, I guess we're
to go
meeting,
back
we're
to
meeting
that
again,
weekly.
and
Yeah.
are we meeting in July? We are. What is it now? I'm
Just let
sorry.
me point out, we're going to continue to get reports from the state on cases. So it's not as if the staff won't have a clue when all of a
Right,
sudden,
right.
if there's a spike. And otherwise, we'll get updates each month at
Yeah.
our meeting.
And also, we still have the weekly reporting for our surrounding towns that is released,
Okay, sure.
including Westborough's numbers.
And then the other part of the discussion was that currently we still have was it an advisory? Is that how we had worded it? And so the question is whether it's still appropriate to stay under the advisory or whether we want to think about either changing that.
So before you came in, Jen had reported on the latest wording from the state, which you want to repeat that?
Sure.
Because that seemed reasonable to me.
Beginning July 1st, the Mass Department of Public Health advises that masks indoors are optional for most individuals. Masks are still recommended for those at risk of severe disease and required in certain settings, such as healthcare facilities.
That's the current Massachusetts.
Yes.
guidance.
It's as of July 1st.
Okay.
I mean, I know people that are still getting COVID, and so I am a little nervous that if we back too far off any recommendation or advisory that we have, that people might read into it as problem's gone away, don't have to worry about it anymore. And I'm not, I'm just trying to make sure that we frame the message correctly and that it still exists. I mean, the people that I know that have gotten sick have been kind of out for a week. It's definitely worse than just a cold, but at the same time, no one that I know of is being hospitalized because of it. I don't know if you guys are still seeing huge upticks in the hospital themselves.
I don't go to the hospital, so I don't know. I have not
Yeah.
been sending people to the hospital from my office or urgent care.
Yeah.
I think I have, currently one in the hospital with COVID, but in general, it's just been a very large number of outpatients, and I'm seeing finally it slowing down just a little bit this week, but
Yeah, so I want our wording to be respectful of the fact that it's not like problem solved, gone away, but at the same time, I don't want people hiding in the corners of their house thinking that they're going to die if they leave their house. It's like,
Sure.
how do we find that balance? And I think the Massachusetts wording might be a little too much of the problem's gone away.
Okay, so I guess I don't hear it that way, and my question would be, if we're going to have a more, more cautionary stance than the state, I would hope that that's warranted by local circumstances, which at the moment I don't see.
Right.
Again, they're saying basically masking is optional, so it's not a question of they're saying it's all clear. They're indicating high-risk people need to be careful. I just don't see anything in Westborough that makes me think we should have a policy different than what the state's putting out right now.
Yeah, and I'm not even sure I'm advocating a different policy. I mean, if the net effect of what we're telling people is that masks are optional, I think it's still very consistent with the Massachusetts policy. It's how we word it.
Sure, but if we recommend masks, that's different than saying they're optional. I mean, we're not mandating it, but it's our advice that you should do this.
What are your thoughts?
I mean, I personally still think there should be an advisory with the numbers not dropping as quickly as I wish they were. So I mean, it's an advisory, right? It's not a mandate. It just, a lot of people feel that the state isn't giving strong enough wording in the past few months. I mean, I hear you, Alan, but I don't know. I kind of agree with Nathan.
The trend is definitely downward. I'm thinking, so if this is the June meeting, maybe we should look at pulling way back on our messaging in July, and just keep our advisory as it is for another month. I mean, the number of cases, 38 or 37.
No,
right?
she said it's fewer than that. It was 15.
That's so far this week.
Right, there was
Yes, yes.
28.
Through.
It was 28 last week,
Oh, it's
total.
28? Oh, okay. And so that's still, I mean, more than we had in a given week last summer, right?
That's, sorry, 28 plus the
the
school-age children.
Okay. Yeah, so that's still, I mean, more than we were having per week last summer. I think that reporting might be a lot less as well. I think there's a lot of people that might just be taking at-home tests and not bothering to report it. So I'm not sure that I'm quite ready to pull our advisory back.
Okay, I mean, I always have the worry that if we, that we maintain what I consider to be credibility with the public. And if we are recommending things that aren't necessary and people tune us out, then I think when we want them to listen to us, it becomes that much harder.
So if, let's say, 10 people per week were getting sick drinking the water from the, Westborough water supply, and we had an advisory saying, you might want to be careful drinking the water in the Westborough water. If we then had, I don't know, I guess we had the 34 people, right? The 28 plus 6 in 1 week, every week. That to me seems like it's worth still having an advisory, regardless of whether Massachusetts is saying that it's, oh yeah, don't worry about it. That's expected. I mean, it might be expected, but we're trying to keep the health of the Westborough population, and one way to do it is by trying to be careful around certain diseases.
So suppose it wasn't COVID.
Yep.
Okay, you just have, coughs and colds going around from rhinovirus. Okay, we might still say, well, gee, a lot of people are getting coughs and colds, and we would issue a mask advisory or something to try and prevent that. I'm not sure that,
I'm sorry, why would we compare it to coughs and colds?
I mean, I think that.
in other words, we know about coronavirus because we test for it.
Yeah.
There's all sorts of other respiratory illnesses that people have, and I see plenty of that, and we don't test for it, and we don't worry about how many of those are out in the community when we are doing our deliberations.
But what we do know is that for cases like coronavirus, people are getting sicker than for like coughs and colds. They basically know they have it even without a test in many cases because they're really sick.
I mean,
now, I don't know of these 38 plus 6 cases, how many of them are to the point where it was a case where they're missing work or missing school, or whether these were asymptomatic people. Because you're right, if it's all of these, 100% of these were asymptomatic cases, then you're right, it's much more like coughs and colds. If this breakdown, though, is more like they're out for a week, then that's much more serious.
Well, I mean, okay, that's certainly true, and we don't know. I doubt they were all asymptomatic. That would not be likely. On the other hand, strep throat, when you have that, you're feeling pretty awful for a couple of days, not necessarily a week.
Flu.
Well, flu is, is another example, where you certainly would potentially be laid up for a more extended period of time. Again, even with things like flu, who's at greatest risk? It's the people with chronic lung disease, people with asthma, people with other, problems with their immune system, things like that. So I just feel like we don't have data suggesting that these people are getting really, really sick. Some people do get sick, but I think most people who get coronavirus right now, not in the beginning, but right now, are getting relatively mild viral infections. There's also the possibility of long COVID and problems related to that. But, if you think that COVID's going to be around for a while, which I do, I don't think it's going anywhere. I think we're at the point where we're going to have a low level of COVID in the community indefinitely. I think we have to think, what is our long-term strategy? And I'm not sure.
So let me try to flip this around a little bit. Let's pick a case that might exist somewhere else in the world. Like if you were in an area where like malaria is endemic, right? And you say it's here and it's around and it's going to be here for a while. We're not getting rid of it anytime soon. You might still have an advisory to have like mosquito nets up, right? Because it helps prevent the spread of a disease, even the disease that's endemic. So I want to be careful that we don't just use the excuse of, well, it's going to be here for a while, so we shouldn't do anything about it or shouldn't worry about it. I mean, just because it's here and might be sticking around doesn't mean that we shouldn't advise people on how best to prevent it.
Sure, but that also is a factor to take into account.
I think especially if we talk about putting in like a mandatory mask policy or, shutting down certain events or schools or things like that, your criteria, is it sticking around or is this a very short-term problem, becomes really important.
Yeah.
It becomes less important when we're talking about whether we're recommending that like indoor public spaces, people, that are crowded, that people, wear masks. So I think that as we move to that gray area, I think any of these are acceptable conditions. And so it's just a matter of where we feel we want to be today.
So we can do nothing, or I can make a motion that we change the advisory to just some guidance, and you guys don't support it if that's how we do it, but I think we should take a position one way or the other what we're doing. Or if you...
The other thing to think about is these new variants, unfortunately, that are kind of creeping in, and I don't think we're seeing them yet, but the BA4 and 5 that are unfortunately in our future. And so are we going to have another spike at the end of the summer? I'm not sure. So it's right now I wouldn't consider, obviously we don't know the numbers for this week, but 28, when we don't know all those positives that people are doing at home, to me isn't necessarily low level. And I would want to err on the side of caution and just still advise people to be masking in crowded indoor spaces, at least for this month, and then reassess it in July. I mean, if you want to change an advisory to a guidance, I don't have a huge...
I heard most of what you said. I didn't make out that last bit you said after. You said you want to maintain the advisory through July.
Yeah, through July is what I would recommend, but just because of, to me, the number isn't completely what I would call low level. And I just feel like we don't know ever what's coming with this virus. So the fact that it's going down is great, but I kind of would want to see it to continue to go down before lifting an advisory.
So I think that's pretty similar to my position. So if you want to just get on the record a motion, you can. Sure. But I think that we'll probably vote no.
Yeah, sure. I mean, if you guys want to make a motion to continue it for another month, we can do that. But that usually doesn't take a motion. So
right.
All right, so I'll move that we change the mask advisory to just recommendation that people who are at risk be aware that masks are an important way they can protect themselves in indoor spaces, and that we align our language with the language of the state.
And as part of that, to drop the current...
And to drop the current advisory.
Okay. So... We can either do this by roll call, or
You have to get a second before you even vote on it.
Yeah, do we have a second?
So I second it.
Oh, you do?
Well, no, so if I'm
Just to bring it to
seconding
the floor
it,
for discussion.
I'm sorry. If I'm seconding it, that doesn't mean I agree.
No, we still vote. We still vote.
But it brings it up to the level where now we can discuss it.
Yeah, I'm sorry.
If you don't second it, it just dies and we move on. But I'm more than happy to have the second.
I second it, yes.
So any more discussion on this, or should we just vote?
We don't need to do roll call, we're all here.
Okay, so all in favor? I see one vote in favor, and so that does not pass.
Well, you get.
Oh, no, she seconded it.
No, we're okay.
Didn't,
What's that?
didn't she, you seconded
That
it?
doesn't matter. Okay, now you
All
gotta say, you
opposed?
have to all opposed.
Oh, yeah.
Right now it's a tie. Okay, now it goes down to defeat.
Okay, there you go. Yes,
Okay.
thank you, Alan, for keeping me honest there.
All right.
Okay, anything else that we want to discuss relating to COVID-19?
Sorry, what?
The question was, anything else with respect to
Do we
COVID-19?
still have tests to give out?
We do, and we'll be getting 7,000 more in the fall.
Really?
Yeah, we
We
are.
are, and then-
We're down to
okay.
our last case.
Great, thank you.
But everyone can call the number that's on the website to order their,
And do most towns doing the same thing? Because I just have patients telling me every day, where can I get them or whatever, but,
yeah,
I'm just curious.
I know our surrounding towns have.
Okay.
And I know
thanks.
they're
So
also
send-
getting
send
some
your
tests from the
patients
state.
to some other
Send them
town.
to Westborough?
No, to some other town.
Yeah.
Unless they're Westborough residents, but, okay, so we can move on then to the annual town meeting warrant article. This is the one about the plastic reduction.
Yes.
You want to just introduce where we are right now? I
Sure.
think you've had a meeting about this, is that correct, Jen?
Yep, so our last meeting, we decided to discuss holding a public hearing in July. So we have to schedule a date for that, and also for an informational hearing. And it's regarding Article 33, or the old Article 33, the new Article 38, about the plastic reduction bylaw. There is some minor changes, but the big one would be for restricting the takeout containers for restaurants.
So wait, I thought one of them already passed.
Yes.
Oh, okay.
So the one that is charging 10 cents a bag at grocery stores or retail stores, that has been approved. So that was Article 37.
And, but they haven't approved getting rid of the thin plastic yet? Or we have?
They have, however, Article 38 has to go through the Board of Health to advise the town meeting in the fall.
And so one of the things we wanted to do is have a town-wide meeting so we could get input from both the residents and the businesses in town, because this is a pretty wide-ranging impact.
So wait, is 38, I thought, is it only the restaurants or no?
Well, it's throughout, but it mostly affects the restaurants.
And so do we want to pick a date, or did you want to just find a date that works best for the department, or?
What is 38, other than
You know,
restaurants?
what other
takeout,
constraints do we have? I mean,
We can do it during our normal Board of Health meeting, part of that, or we can set a different date for that.
So I'm sorry, aren't we discussing only restaurant takeout containers? Or
No,
is
so
it-
it's the whole Article 38
what
and all the
else does it-
changes.
What
So
else
that,
does it include then?
excuse me?
What else does it include? It says,
So anything that's in bold or in the wording that's been crossed out is the changes of what the current plastic bag bylaw is. So it'd be, they added the definition of restaurant, they added definition for biodegradable. They added the word restaurant in section 3B. They added the section D.
I'm not seeing,
I'm missing a page, I think.
am I looking at the
Oh, I'm
wrong?
missing page 33.
yeah.
I'm sorry.
Did you, so that is, yeah, so Paula sent you
Oh, yes.
the wrong one, but then you should have the correct one in there.
The ones you sent by email, I didn't print out because I got distracted.
Okay, so why don't you guys look at mine?
Okay, fine.
So it's everything that's
I
highlighted?
think you didn't send us 33.
Okay, so 3B,
this,
if a grocery store,
this,
retail, or
bulletin,
restaurant
this.
provides this.
and so the part that's not in bold or not crossed out is
It's still-
already a bylaw?
Yes.
Yep.
So those are just
So the
the
question,
changes.
so one of the questions to us is, do we think it's a good idea restaurants be added to this list? Okay, so if you go to Chengdu, or you go to Three Gorges, or you go to Mayuri or whatever, and you order some food to take home, if they give you a bag, then they would have to It could not be plastic, and they would have to charge you if the
They have
key
to
part
charge you,
was.
yep. That part is passed.
Well, I thought that was still waiting for the,
AG, yes.
yes, okay. But, so, the question is, do we want restaurants included in this? Or if you go out to eat at Tavolino's, and at the end of the meal, you want to take your food home, and should they be allowed to give you a bag or not? Or what would be the restrictions on those bags?
Yep.
Basically, they'd have to use brown bags, right?
Right, yeah,
They'd have
there's-
to all switch to brown bags.
Or some other type of biodegradable material. I mean, in principle, I'm not against it, right? I think it sounds like a good idea. I'm worried about how it gets implemented, and I think that hopefully the restaurants can bring either a consensus as to how they might, adapt to it, or that they won't adapt to it, and how people would respond to it. So I'm kind of, I don't have my heart set that this has to go through. I'm not set that it shouldn't go through either. So I'm more waiting to hear more opinions from the people that might be more affected.
Great, so.
But if you
Yeah, no,
guys think it's a good idea or a bad idea, I'd love to hear.
I was confused why the selectmen bounced it back to us.
Because we oversee restaurants.
Okay.
And it's also, I think that part of this was a environmental health type of issue. And so from that point of view, we also see a lot of
But we
nuisance
do
problems,
regulate
pollution
trash,
problems,
yeah.
and trash and things like that as well. So that's part of the reason why they
So,
offered to give it to us and we
I'm
accepted it.
definitely all for it. I agree with getting a feel for the town, the town's thoughts on it too.
So I have some concerns about this, particularly what the impact is on the businesses. And it's not that the business has to, charge for bags, but if it makes coming to Westborough to eat at restaurants or to get takeout from restaurants in some way a less pleasant experience compared to other places, that would be my concern. And, if you get some food and you don't get a bag and you say, I'll just take it and stack it and it spills, at some level, even if it's your own fault, you're going to blame the fact that Westborough has these rules or this or that.
Yeah,
So-
or
Well, in
imagine,
other towns that have this, Jen, do you know, or does anyone know, I'm assuming they don't give you the option for a 10-cent bag when they ask you, if you want to take something home, they probably just automatically would charge it.
No, so it's hard because we're not sure if the AG is going to pass or not. Some cities have been approved because they're a city. Other smaller towns have not, the AG has not passed this bylaw. So the 10 cents, if you go to a retail store and they say, okay, you want a bag for 10 cents or not, you don't have to pay that. But they don't automatically charge you.
Do we know of cities or towns that apply you have to pay for a bag fee to restaurants? Does that?
Oh, is that the question? Sorry.
Yeah, that's the question.
Oh, sorry.
Okay.
So-
No, so I don't know that answer. I think anyone that has a 10 cents requirement is required as establishment in that town to pay for that.
So I think, I know I've been to towns where they ask you if you want a bag, and if so, they ring you up, your 10 cents a bag. But my experience has always been in a retail establishment, not a restaurant. So
It would be required in a restaurant here.
I know that. That's not my question. My question is, can you talk to the Mass Restaurant Association? Are there towns where they're applying this to restaurants?
Okay, so you want me to find that out for you?
Yes.
Okay. It wasn't sinking in.
Yeah, I know.
the other situation that, if I stretch my head, we could run into is, let's say, an Uber Eats or a food delivery service, something like that, decides that the risk to their cars is greater in an area where they don't have plastic bags, so they just decide to stop delivery services in Westborough,
Well,
right? I mean,
you bring-
I don't know if that's likely or not,
Service
but
is going down very quickly due to the cost of gasoline.
yeah, that's true too.
You
but-
have to remember, though, this is not on our plate, our 10 cent
No, we get that.
Okay.
No, but this is about the getting rid of the plastic
Plastic bags. Yeah.
for
So
restaurants.
taking up your scenario one more, I know a lot of restaurants will have a delivery person who goes out to like 5 or 6 places. And by having the bags, it's clear what food goes to what house, if you know what I mean.
Well, they
I
would
don't know
ha-
if
they
it's
would
any
have
different than
to
a paper
put it-
bag with like,
Well, I suppose you do it with a paper bag, sure.
this isn't saying get rid of all bags. It's just that, what is it, that must use biodegradable material. So for something like
Which
that.
could be cotton.
What's that?
It could be cotton.
Yeah.
Could be,
Cotton?
well, a restaurant's not going to,
I'm just saying like it could, I'm just
Yeah, okay,
explaining what
But if it was
materials
a-
are besides brown paper bag.
If it was a professional delivery service, they could also have plastic cargo container type things. So
I mean,
that-
most of these, you've seen them, somebody's got a car with a thing on the roof and,
I
yeah.
don't, but that's fine, yeah. So again, there could be unexpected consequences of this, which is, I think, valuable to have the town meeting. We do want to make sure it's properly attended by people that might have ideas. So I'm not sure what the best way to advertise it so that we actually get the people that want to come in for ideas rather than just the people that want to come in and yell.
So our, Zach Bowner will be sending a notice out to all establishments
Okay.
about our public hearing.
So again, if we notify all the food establishments.
Yep.
We notify Sustainable Westborough. We I think that would represent the people who are, particularly in favor of this.
Yep, and then we do all our normal advertising, like in the newspapers or something, but I'm
Online,
not
yeah.
sure that most people see it there. I think
Yeah.
they most hear about it other ways,
Just
so.
post it on the websites and whatnot.
Okay.
Facebook.
And you're thinking we want to do it at our July regular meeting?
That's completely up to you.
You in favor of just combining it with our regular meeting? It makes for a long day, especially if that meeting runs late. Do we have anything special that might be coming up on the next July meeting that has to be like booked with a particular time?
Your
Ask
reorg.
advisory.
Yes, but not with a particular time.
No, just kidding, sorry.
The new chair appointment.
Oh, okay.
I mean, that'd be easy to include that, just that one item if you wanted to do
What are we
that.
doing?
New chair?
We usually do it at the June meeting.
No, July.
It takes effect in July, but you think we do it,
So, yeah, so whoever is, I just went through this is why I know this. Whoever is current would stay until the next meeting in July.
Okay.
Because it's different this year.
it does change things if we do it that way. But we'll get to that in July. Okay.
Okay. Yeah, so I'm thinking that the July meeting would work for me.
For me?
My July schedule is
I think it's the
pretty open.
16th, is it third Tuesday?
19th?
19th, is it? Maybe?
I think so,
Yeah.
if I'm on the right year.
I can look.
Yeah.
Okay.
Okay, community health assessment was the next item, there's nothing more about the article? You want to introduce the community health assessment?
Sure.
And I think this is coming off your director issue plate, correct?
Yeah. So July, you want the July 19th? And for an agenda, do you want just the hearing is on the agenda and the appointment?
We'll want no, I mean, I think that it would be good if we have on the agenda just the other normal July
You
stuff
want a whole
too.
meeting?
Yeah.
Okay.
But we can do the town meeting, general town meeting first, so it's
Okay.
at a particular time. And then if we have to postpone items, we can postpone them,
All right.
if it gets to be really late.
So I approached the town manager to have our ARPA funds be given for this opportunity of a community health assessment for the town. Currently, so the cost of the job, the community health assessment would be from $60,000 to $120,000. And it would be lower if we can get grant money, which is predicted, and also for surrounding towns to be involved in also doing it. So I went with the high end, and currently, right now, she wants to sit off and hold off on doing so and sit on it and wait to see what the other surrounding towns do, if they're going to adopt that or not. And then we'll look at it then and have it at a reduced cost. So there will be a senior needs assessment being completed that's already in the works. So we'll find some information out from that. It is geared
What
just
type
to,
of information do we expect to get out of a community health assessment? I was a little unclear, like, what sort of finding would we get that would be actionable in some way that would change kind of something that we do?
yeah, so you can have specific programs set up. We have an EPI involved, and she is a regional epidemiologist with all our greater boroughs for health. And she's actually taking the lead on this. But you can look at smoking, if it's an issue in Westborough, or asthma, or birth control, or any community deficit that you're seeing for health. And you can have a program created toward that to help that if it's a deficiency in Westborough, and have grants pay for a program to help with this need. And it's any public health entity that could be covered. So this was brought to you prior to me knowing that it wasn't going to get approved, and brought for the select board for approval in the finance committee. So I'm just opening your eyes that this might come along down the road.
Sorry, not quite hearing all the words. So you're saying that this was not approved by the select board?
It hasn't gotten that far yet. It's going to be sit on and held until we see what the surrounding communities are going to do, because then we'll have a better number how much it's going to cost us.
Okay.
But I just wanted to make you aware that this is something that could take place.
Okay, and do we get to shape any of this in terms of like what areas they look at, or this is just a comprehensive health assessment where they go out and just kind of try to figure out what our needs are?
Yeah, we would create a committee, and you would look at, they'd bring in ideas of what they think we need to have looked at, and also the consultant that we would hire would also advise on what they think we should look at, and what kind of questionnaires are released into the public.
Okay. Good. So then I guess there's no action then on that? Eli?
Not yet. I mean, you can take an action if you want to move it forward on your end, because it's going to probably have to be eventually anyway. So if you wanted to do that.
Sort of this as a way of doing some proactive work.
Yeah, I think that's typically we're reactionary, and so it's
Yeah.
nice to kind of get out in front of any potential issue. Okay, so let's take a vote to move this forward, and, just kind of a support of moving forward on the,
I move that we support the community health assessment and direct the health director to represent that to the Board of Selectmen and the Finance Advisory Committee.
I second that.
all in favor?
And I said
Unanimous.
Select Board, not Board of Selectmen. You heard me, right?
Yes.
I still can't say it.
Yeah, I know. So
Just
just say Select Board and I'll be.
Yeah.
Is the select board.
But
They changed it
Did they
recently.
change it?
Yeah.
Yeah, to be more inclusive.
Oh, got it.
We've never had that issue. We've always been a Board of Health.
Yep. And it's the school board, the Board of Health, so Select Board.
Yep. Let's see, and so the next on our list is the E.L. Harvey contract for 22-23.
Yes. Okay. So, and then.
I don't think I got that in my,
No, that's the
But-
handout I gave prior
oh,
to the
okay,
meeting.
yep.
So I have a question, which is the $50 per ton for handling. What are we currently paying?
44.
So that's a hefty increase, about 15%, as I recollect.
It's not budgeted. We're not budgeted for fiscal year 23 for that amount either. We budgeted for 46, which is a 2-year increase, which is normal, and that's been the norm.
So do we think this increase is because of the price of gas? Or do we think it's because they've sold the company to a larger outfit that is trying to get a greater return on their investment?
That I don't have the answer to.
I mean, unfortunately, right now, when you are trying to negotiate a price in the midst of 10% inflation,
Yeah.
every couple months, going from 44 to 50
Okay, so I
is
guess,
not unheard of, but it's obviously not budgeted, right? So what happens if we approve it and we don't have the budget for it?
We'd have to go to the finance committee and explain at some point.
so is this something they have proposed, or did you negotiate the 50 with them?
No, we've asked for numbers, and when I did the budget, it was going to be the 46. And then Ben came back today and said it'd be 50 per ton.
Okay, so I think we need well, I mean, obviously we have a meeting now. We can always have an emergency meeting to approve it. But I think we need to have an understanding of why it's going up so much. And if it's one thing if it's fuel. Because if it's fuel, you could put in a fuel rider that basically says we're going to pay 46 a ton. And, if gas or diesel is above a certain amount, they can pass that on to us as a thing so that when gas prices come down, which they will eventually, we're not stuck at 50 and that's not reset as the new normal, new baseline.
Would you like me to invite him to a meeting?
I'm sorry, what's that?
Would you like me to invite him to our meeting or have another meeting with him present?
I would not like to do it at the same time we're trying to do the,
No, I was thinking a different meeting.
yeah, so I think it would have to be a different meeting. It might also be worth talking to the finance committee just to figure out, what we have, what we can afford to pay. If it turns out they come back and say that 50 is not acceptable, then we've got to figure out how we make something acceptable.
Yeah, I mean, my sense is that things like these negotiations should be you and Christie and just bring us the best number you can negotiate.
That might be better than a public meeting.
Yeah, bringing
I think we
them
can
to a
do
public meeting is not
better
a-
negotiation without it being in public. If you want one of us there, certainly one of us
Yeah.
could be there, but as it more as just a price sort of thing, it might be better to have Christie there.
Yeah.
All righty. That.
And if that's the case, then whatever the final number is, if we need this approved before the July meeting, we could do a separate emergency meeting, but if we just need it approved by July, we can do it at the July meeting.
All righty.
Anything else in the contract, though, that was concerning to anybody?
There was no other change.
I don't have it, I'm sorry.
You said there were no other changes?
No other changes. The only
Okay.
one I can think about, it might be Juneteenth might be on as a holiday day. I don't know. Do we know? I don't know. That might be the only other change that it
It's
wasn't
just adding the
recognized on
additional
here.
holiday?
Yeah.
Do we need, because you mentioned it somewhere else in the material sent to us, that mattresses and textiles can no longer be,
Starting in November.
okay, but this contract will cover November.
So I've already had a discussion with Harvey. He's, by law, has to take care of it, and he's going to be doing that on his own. I did file for a grant with DEP to bring a trailer there for him to use to do the mattress recycling. So if we get that, he'll be using that. If not, he'll be using his own trailer, but he is recycling on his own, the mattresses, with a fee to residents directly.
So this means mattresses don't go over the wall, they get
Correct.
pulled off to the side.
Yep.
We're trying to get a grant to cover the cost, but if we don't have the grant, then
He'll use one of his trailers.
they'll just charge a per mattress fee to
Yep.
dispose of it.
So just, they'll charge the mattress fee regardless. It's just the trailer itself, if it's covered by the grant.
What is the fee going to be charged, do we know?
I do not know.
All right. So you don't think we should be expanding when we itemize recyclable materials, metal, newspaper, plastic, glass, and cardboard, that we shouldn't put mattresses and textiles?
I can
in
do
list?
that.
I think we should.
Okay.
Yep, okay.
Yeah.
Okay, so then moving on. We're actually starting to catch back up on time. The Waste Management Task Force, we have some comments you guys want to share with us?
Yeah, so essentially the committee has come and made proposals to Christie, and then I guess they made proposals to the select board. And it was Christie's feeling that that task force has done what it was set up to do, and that going forward, the select board would put together a new committee to take further action. that new committee is composed of I would say, broader constituency, but one of the constituent members that they have designated is a representative from the Board of Health. So I believe it was up to us to select our own person for being on that committee.
And it made sense to us that it would be Alan because he's been part of it from the beginning.
However, he is more than happy to let somebody else do this if they would like to.
Oh, you've been doing a lot, so you let us know whether it's starting to get too much. I would rather have you hand off a few items than get to the point where you decide, I'm done, I'm just leaving the board.
No, I appreciate you saying that. No, I do think, again, there has been a certain history and understanding of what's happened so far, and so it probably makes sense for me to stay involved.
Okay.
So,
If that does change, let us know and we can, reappoint someone if
and
we,
you're on this new committee as an
Unless
ex
you wanna be
officio,
on
is that
it.
right?
Christina, yes.
Yes.
Not yet, not.
Not an
if he-
actual
he
member.
wants to Continue. So wait, is this the committee that was dealing with the recycling? Okay.
It will look at things about recycling. It will look at ways to reduce our total trash tonnage, whether that be pay-as-you-throw, a town-wide curbside program, and everything in between, I would say.
And that didn't get decided with that last committee?
Saying, didn't the last committee decide that?
Yes,
So the last committee, what they
like
did,
all those presentations.
yeah, they looked at some options, but
It wasn't complete, though.
yeah.
yeah.
It
And was
opened up
felt
a
that-
whole
well,
range.
It was felt that when you're getting to the point of things like doing an RFP from vendors for, let's give us a townwide curbside program, that it was beyond the scope of that level of activity to then make a specific recommendation to the select board was beyond what the original committee was set for. So the work of the original committee basically said, this looks like a reasonable option to pursue, but that committee, is very small, doesn't have the time and resources and the backing of the town in the way that's necessary.
Okay, so I make a motion that Alan will be our representative to that committee. Do I have a second?
I second it.
All in favor?
Aye.
Excellent.
And then we have to take a vote to disband the task force.
Okay,
Move we disband the Waste Management Task Force, subcommittee or task force of the Board of Health.
I second it. All in favor?
And what I'll tell you, just in case you're curious, everybody on the task force understands it's being disbanded. They're fine with that, and most of them, I don't know if everyone, but a significant number of them will wind up on this new committee.
But because it's from the select board, it's going to have different powers and stuff like
Correct,
that.
that is exactly
Yep.
correct.
Okay, let's moving on to the director's report. Excellent job on getting the hazardous waste day set up.
Oh,
I think
thank
that's important.
Yes.
I was interested in the after-action report on the local health departments, just trying to figure out whether other health departments had similar issues that they handled differently than we did, whether there's any learnings there for us.
So there is actually a slide presentation created by our planner, and I can send that to you.
That'd be
to
great.
review.
Okay.
The other thing is the Central Mass Mosquito Control Project. In past years, I'm not sure if this happened after you started or not. We have had residents who've had concerns about spraying near their homes. So just if we can make sure it's well advertised when they'll be spraying, how people can avoid having the area right around their home sprayed, things like that.
Okay.
I think there's two groups of people, ones that are personally worried about the health effects on themselves, and the other that's mostly worried about like their bees and other insects that they might have in their yard.
Honeybees, yeah.
And so those two groups represent the ones that, we just want to make sure that they're aware of what we're doing.
Okay.
It is on the website.
I couldn't hear what you said.
It's
Paul.
on the website.
On the website, we get a report from CMM.
Central Mass Mosquito Project.
Yeah. Anyway, we get a report telling us ahead what dates they're going to be spraying in Westborough. So I put it on the website each time one comes out so that people can call and say, no, don't spray around my house. And they
Maybe you
also-
can reach out to something like the Community Advocate or something like that to get something, just a notice put in there that says if you're not,
Right, yeah, I agree with that, I think.
yeah, if you have concerns, call the Board of Health.
I mean, would we want to consider, have they ever sent out like an email with a link for the dates, or no?
No, everything comes through our office and then we push it out. I mean, anyone can go on their website. It's advertised too.
How hard would that be, though, I just think that people are pretty sensitive to that, and especially if people are new to Westborough and don't know to look for it.
Yeah.
You know, could we send out an email, just, you know,
But I don't, to who? To whom?
to the town, just like we would send out an email regarding a mask advisory? Can we send
Oh,
out?
you mean
an-
like a reverse 911 kind of thing?
I don't think we
No,
have
just an
emails.
email to the town, just.
Yeah, I
you know,
have no email like that. No.
How do we send out the mask advisory?
On the website.
Oh, so when
Okay,
anything that's entered onto the website automatically gets pushed out to email that people have signed up for. So they do get
Oh, is that
notified.
because I've signed up for it?
Yes. I was like, wait a minute.
Sign up, so I don't get those. So I'm like, there's no townwide email list.
Okay.
That database.
Let's see. You mentioned the civic and the director's report. I was
Yes.
just wondering, what's their timeline for repairs? Do you know?
So I met the contractor out there with the fire chief, town manager, and the building commissioner, and it looks like it's going to be a drawn-out process. Looking
all summer?
closer, yeah, we're probably looking closer to 3 to 6 months,
Okay.
but it's not written in stone yet. There was more to the project scope than
Okay.
was anticipated.
We can always come back to this in the health inspector's report if we want, but I just wanted to get that sense
Yep.
of whether they're managing okay or whether they're floundering with the kind of separate truck outside.
I don't think there's any problems with that. I did go there, I was on site last Tuesday, and there was some violations there, but he rectified them right away.
Okay.
Okay. Do we have to approve each of these reports? Right, we just move on to the next one, right? So the Sanitarians Report?
So, Sapporo, this isn't the first time they've had problems with their HACCP paperwork, as I recollect.
No, it's not.
Do they not understand the importance of the paperwork, or what's the issue?
I think with us shutting him down and not allowing to open till he got the paperwork, I think he has finally gotten the point, I'm hoping. It's the most we could really do, and that's, we shut down the sushi bar area until they cleaned. The fire department actually shut them down for another reason, and they opened the next day, and they had all the paper. They called us in. They opened without the sushi bar. They called us in, and they had everything for the HACCP paperwork completed when I went in, and then I reopened the sushi bar.
So it was just closed for a day?
I think it was like maybe 18 hours tops.
Yeah, so next time you go back in there, right now they're on the every 6-month schedule?
Yeah, the paperwork is good for a year, so we won't know until next spring
Well-
if they've done it again.
I assume that the 5 Priority Foundation problems
Yes,
are
everything else,
not just
yeah.
HACCP.
But a lot of those priority foundation issues and the priority ones weren't something that would shut them down normally. So,
Right, but we also don't like restaurants operating with some sort of variance if they're
but that's why
having
we
a lot of
have,
issues.
that's why we have 2 separate permits, one for the sushi bar, one from the restaurant. We can shut down the sushi bar without shutting down the restaurant. And that's why we shut down the sushi bar. And what I'm saying is that the violations that shut down the sushi bar are a year violation because the paperwork is good for a year, so they just got it, so it'll be good till next June or next May when I was there. So it'll be good till next May. So we won't know until next May if they mess up on the HACCP plan again.
Yep.
So I guess of these 2 + 5 + 12 violations, how many of them were related to the HACCP, or were these, or they?
The 2 priority and 2 of the priority foundation were the HACCP.
Okay.
So those are your major ones were the sushi bar, and it was shut down.
Can you make a note to self that you inspect them in June and not May, so that there's time to find, I mean, because if you go in April, well, obviously their plan will still be in place. So because this has been a recurring problem, if you could make sure it's going to be, where your inspection is after the time when their new paperwork should be in place.
No problem.
I hear in a lot of the state, lifeguards are an issue with the pools that you've been inspecting. Do you check to see whether they have lifeguards for these public pools, or is it just up to them?
They have to turn them into us. I have to get certificates for every lifeguard. I put together a spreadsheet, and when I go out, I make sure that the lifeguards are on the spreadsheet, that they have ones that have been certified by us. If they're not there, I have every right to shut down the pool until, a lot of times, if the person's there, I go in, I ask their name. If their name's on my list, they're okay. If they're not on my list, I ask them if they have their card on them. And if they do, I tell everybody to keep it on their phone. If they can show it to me, it proves that they are certified to be a lifeguard in the state of Massachusetts. I will allow them, but tell them it has to be sent to me within 24 hours, or they can't lifeguard at the pool again. That's how we've been doing it for years, unless we want to change anything.
And so these pools that you've inspected, they've not been open, so there hasn't been a lifeguard at them, or you inspect them with them open? I guess I'm trying to figure out how that works when you're opening, checking pools.
Well, an opening inspection just says that the chemicals are ready to go when they're ready to open. I always open 2 to 3 weeks before they're going to open to their members or to the public.
Okay.
So they have that amount of time to get me the lifeguard certificates. And
then you go back during the season to check?
I go back 2 or 3 times, hopefully, during the season. I usually go once a month to check the chemicals and make sure the pool's running correctly.
And have you noticed any problems with pools once, with lifeguards?
Last year was difficult. We were short-staffed, so we didn't get out on them. This year, I plan to be out. We do have some pools only turned in 2 lifeguards, and I noticed their names were on 2 other pools. So when I go, I have to make sure. We do have one pool that said they were only going to open Thursday through Sunday right now because they don't have enough lifeguards, but they're hoping when the kids get out of school for the summer, they may have some high school kids sign up to be lifeguards because you only have to be 18. So they're hoping they do have some 18-year-olds that come out at like seniors who, before they go to college, want to work. Right now, just on another note, the beach isn't going to open with lifeguards this year because we don't have lifeguards.
Yeah, that's what I had heard.
So that's kind of, it's not just our town. Framingham, I think, is the same way.
I think it's all across the
They have no
street, yeah.
lifeguards. It's just nobody's
It's
going.
statewide.
It's
The
statewide.
beach is opening just without lifeguards.
That's through the select board and actually it's through the recreation department. All I know is I test it. I tested it yesterday morning, yesterday morning, got the results back today by email. I'll get the letter tomorrow, but by email, it did say that we were under 5 parts per million, and as long as we don't go above 35, we're in good shape.
Let's see, the wording on the Windsor Ridge one said that the facility must repair or close the pool.
Closed there.
It's the children's pool or whatever.
Yes.
Yeah. Is it more of the pool is closed until it's repaired and inspected?
Yep, they cannot get a permit for that pool until they repair. The problem is, they put a new deck in beginning of last year, and they spent $30,000 on new decking. They would have to tear up about 3/4 of it to repair the pool. So I think they're gonna just keep it closed. I asked them to put a latch on the gate because the kiddie pool is separate. So I asked them to put a latch on the gate, which they did. I've been up there to make sure it's there. So it's not open until they decide what they want to do, and right now they want to close it.
And I have one final question about the site plan reviews for 190 to 212 Oak Street. I was trying to picture where that was. I think
Okay.
that courthouse is 186 Oak
Yes,
Street.
so this
is
is
this
that-
between
this is
there
that-
and Route
That's
135?
what we've been calling for the last 2 years, 0 Oak Street, which is the corner of Oak and Milk, where the light is, right there across from the cinema, or
Okay.
that area. That is going to be, I think it's 12 or 14 housing units. And that's what they're, so we did a septic system for that, and we just did a site plan. I had passed the septic system.
There's enough room for a septic system in there for that
Yes,
many
barely.
houses?
They're actually in front of the select board. That gentleman that came in while we were in our meeting was here for 0 Oak Street, and he's going across the street for that meeting. They're just doing a site plan review, making sure that they have the right, they don't go over a certain height, or they have enough room for the fire trucks to go in and stuff like that. We're all set on our end. The septic passed. Steve and I started working on it almost 3 years ago, and that one passed.
Okay.
Where's this, it's 1500 West Park, I'm sorry, where is that?
So a lot of people, that's one of those places, hidden places that people don't know in town. Do you know where the new Olympus building is, the camera building, the medical? Okay. Do you know where Owen O'Leary's is?
Yeah.
Directly across from that street there, follow that down, and when you come to the end, I'm gonna say, there used to be a building there that was, Adele had it after they bought out the other company, somebody else. It's an empty building, but that's the beginning of West Park Drive. And there is you would not know it, because if you're in the center of town, you don't know that there's 10 office buildings over there filled with businesses. At the top is now the new Olympus, and they were looking to put in a medical facility with day surgery, but that one was on hold right now. But 1,500 put in. We had kitchens at 15, 17, and, no, 19, 15 and 17 and 18 were what we had in the past. They closed them all. 1,500 is going to remain a kitchen, and then Maria's handling the other 2 locations down there where they're going to have like grab and go stuff. They're going to make sandwiches at one place and put them at the other place to be sold.
Any other comments
other-
about the sanitarians report?
I move we accept you want to just get through
No,
that?
actually, I think that we probably should have approved the director's report too.
I move
so-
we approve the director's report.
Okay, I second that.
As presented.
All in favor of approving the director's report? Aye. Unanimous?
Approve the sanitarian report.
Second that.
Okay, all in favor? Aye. Unanimous on the sanitarians report, health inspector's report. Were there any questions on this one?
They're all pretty.
So I wanted to add to, I know Jen had brought up the civic kitchen, that she
Yes.
had gone out with the fire chief, building commissioner. An order to correct letter was sent out to the owner in regards to the violations that were found during that site visit, and everything's been corrected. Civic has been very cooperative with everything we've asked of them to do.
Okay. Now, but there's still repairs that still have
Correct.
to be done. But in terms of safely operating with
Exactly.
these temporary conditions, they've been able to fix it all. Excellent. Good. Based on having him in front of us, he really sounded like he was going to be on top of getting this all done. So it's good to see that happen.
Yes.
Question for you about Julio's Liquors.
Yes.
Given what they sell, how could they have 4 core violations?
So they had a lot of water-damaged ceiling tiles. So there was multiple spots, and then there was an issue with one of their coolers.
Okay, fine. Because I'm thinking they just have the thing for the cheese and.
Correct.
And they've got some, room temperature hot sauces and things like that they sell, but it's pretty low-risk stuff.
Exactly. And it was great. He knew exactly what I was talking about, and he actually had orders already in place for
All right, good.
the issues that I found, so.
And don't forget, the core violation is the lowest violation. So it
Yep.
could be dirt on the floor,
Yep.
it could be
Okay.
dusty shelves.
All right.
Those are the kind of things we look for.
I was
in
just
the
surprised
retail.
they had any violations at all.
Usually we're given the certificate of merit to places like that, right?
Yeah.
Good. Let's see. So I make a motion that we accept the health inspector's report for May.
I second that.
All in favor?
Aye.
Unanimous? Excellent. We are going to postpone the vote on approving the minutes until next meeting. I think we've got to select the date, but are there any other directors' issues that you want to bring up?
Not at this time.
No? Anybody else have anything else before we move on to approving the date? Okay, I think we had tentatively talked about July 19th. Does that work for people?
I'm just checking. You have a calendar?
I do, it has all my stuff on there.
Yes, I just want to see the month. So the 20th, right, 19th, okay. 19th will work for me.
Vacation.
As long as what?
Me too.
I make it back from vacation.
Yes. And that one, we probably want to plan for a longer meeting. I don't know if we want to start earlier or that we just want to start at the same time.
My guess is going to be over here, so whatever time you're available.
Yeah, I mean, pushing it too much earlier is not super helpful for everyone's
I'm okay with
stuff,
5:30.
but. Do you think we could do a 5?
I could be here at 5, but
Could you do a 5? Let's,
You're always the third.
1, 2, 3, yeah, so it will be next.
I'm sorry, Paula, I'm having trouble hearing you.
I'm sorry. No, I just was questioning why it would have to be here, because it's going to be the third Tuesday of the month, which is what our normal meeting is over there, so.
So it will be over there.
So, fine, over there is good.
Yeah,
Yeah, better.
As long as it's not in our little room. Yeah. Yeah, and let's try to do it for 5 o'clock.
5 o'clock, okay.
Yeah. Anything comes up, trying to schedule it or anything, just let us know and we can adjust if needed. I think we've, motion to adjourn be appropriate.
make the motion to adjourn.
Second.
All in favor?
Aye.
Aye. Thank you, guys. Appreciate it.
Thank you.